you will ask a question. Okay, but I can do the same according to TCM rules. In TCM, what you do usually for the respiratory disorder, the patient comes, you ask him, so you do spleen 9 bilaterally, you do stomach 36 bilaterally, you do lung 7, for example, lung 7 or 9 or something else. What else you would do? 5, well, lung 5, and other points. You do them bilaterally. So the amount of needles doubles. So you have to use twice more needles than here. This is number 1. Number 2, there is no dynamic in this treatment. This works better. Straight away, in 5 minutes, the patient will say, oh yeah, my sinus is kind of, something is going on, something moving. I feel that it's a bit clearer. Nice. It won't work as fast as local balance within seconds, but it will work within minutes. This is the only difference, because we have to move the whole system. It's not as easy as with local balance or local pain. Okay, so that was the sinuses. And imagine now, the same patient came with the neck problem, the sore throat. Doctor, I have kind of the signs of cold and my sinuses are blocked, but it's not a huge problem, but the throat. So you can treat it locally if it wouldn't be the respiratory disorder signs. But if there is a whole body sickness, what you do? You treat the throat, where the throat is, on large intestine meridian. I suggest to use the reverse image. The throat is around large intestine 5 and slightly lower. Put large intestine 5. The throat is about lung 9. The throat on spleen is on spleen 5, and on stomach meridian, stomach 41. Agree? The pain will go away. When the patient comes the next day, you change the sides. So this treatment will be lung, large intestine, stomach, spleen. And we call this pattern Tai Yin Yang Ming. And later I will show you how we'll make the table, and we will put all the patterns that we learn into the table so we can see and find them easily. Yeah, you can. So I want to clarify that this is the pattern Tai Yin Yang Ming that we use. I just show you how to build it up. Imagine we choose, for example, the heart meridian on the left corner. Let's do this and see how it works. Let's choose the heart here. Oh, you can't see it, like heart. Okay. Will large intestine balance heart? No, it won't balance heart. We just see how we can work out the first structure that we can use for respiratory disorders. Or let's choose another yin meridian, for example, pericardium. Will pericardium balance large intestine? No, it doesn't balance large intestine. Only lung balances large intestine. So we learn this pattern, Tai Yin Yang Ming, and we can use it for multiple disorders. You can just change the points. So any problems in the front of the body, below the eyes to feet, because this pattern balances everything between two branches of spleen meridian. Just change the points. Spleen meridian goes, it's quite wide area. So anything between spleen and spleen branch. So upper respiratory allergy, any allergy, cold, sore throat, throat inflamed in the morning, bronchitis, including scratching eyes, dry eyes, PMS, asthma, cold, shortness of breath, bloating, diarrhea, weak digestion, Qi deficiency of lung and spleen, low energy, poor appetite, digestion plus respiratory. So there are so many things we can apply this pattern. And actually this is the primarily pattern that I use in my clinic for general weakness, anything related to digestion. Also for children. This is pattern number 1 for children. With anything, just change the points. In balance method, we don't think which organ is sick. We think which meridian goes through this organ. For example, the sinuses, we thought which meridian goes through the sinus, and then we adjust the pattern accordingly. So Tai Yin Yang Ming is the basic pattern for any digestive disorders. And when we start drawing our table, that will be the one in the left corner. So if we put here put 4 columns, and here we put Tai Yin Yang Ming. It can be lung, large intestine, stomach, spleen. And here we'll put all Yang Ming patterns. And Tai Yin Yang Ming will be pattern number 1. Later on, when we study Bagua and we will study the meridian conversion, we will see how to apply this pattern for the whole system. But now we learn how to apply the pattern for the Zang-Fu disorders, choosing the local points, for example, for throat, for spleen, for the belly pain,